So we'll quickly try to look at some jerks. That's some characteristic movements due to they are trying to elicit them, by stroking on some tendons. So those tendons will get to communicate to some nerves, and all of that. So we'll get to look at the ones that are done in the upper limb. So these are the biceps jerks, the brachioradialis jerks, the triceps jerks. We have the ones that are also done in the lower limb too. You understand? So for all of them, you should know that they're actually deep tendon reflexes. They are commonly tested in neurological examination because you want to access the integrity of specific spinal segments and peripheral nerves. So biceps jerks now, this is it. The muscle involved is the biceps brachii. The nerve you are trying to check there is a musculocutaneous nerve. The nerve root is the C5 and the C6, but mainly C5 though. So as it tested, the patient arm is partially flexed at the elbow. The examiner places the thumb on the biceps tendon and strikes it with a reflex hammer. So normal response is flexion of the elbow, right? That's usually flexed, okay? But if it fails, it shows you that there's a pathology there, you get. Then for the brachioradialis jerk, see it's at the back. The muscle you are trying to do is the brachioradialis muscle. The nerve you are testing is the radial nerve. The nerve root is the C5 and C6, but this one mainly the C6. So how is it tested? The patient's forearm rests midway between pronation and supination. You're almost turning it at the back. It's not at the back, it's like the side. You're almost turning it at the back, but you're leaving it midway. You understand? Then you now strike the brachioradialis tendon just above the wrist. So normally there should be flexion of the elbow with slight supination of the forearm. If it doesn't occur like this, shows you that there's a problem in the radial nerve, okay, possibly resulting into a wrist drop. You understand? Then we're looking at the last one, which is the triceps jerks. The muscle you are trying to elicit, the muscle you are trying to involve is triceps brachii. This one is at the back now, it's not midway, it's at the back. The nerve there is the radial nerve. The root is a C6 and C7. Mainly we are looking at the C7. So patient arm is flexed at the elbow and supported. You strike the triceps tendon just above the iliocoronal. Okay, so normally there should be extension of the elbow. Do you understand? So if it doesn't occur, shows you that there is a condition affecting the nerve. Okay, so this one is also the radial nerve we are trying to check out. So you can see hyperreflexia showing that there's an upper motor neuron lesion. Hyperreflexia suggests that there's a lower motor neuron lesion. So that's just it. Okay, so for any one of these that is abnormal, the nerve involved has an issue. Okay, and that's how they actually try and make diagnosis in neurology.